Good afternoon. Thank you all for joining us here. We've got a great topic that I think you will find of interest. But before we get started, I want to introduce our next presenter. Jerri Turner-Jacyno is our VP of Strategic Relations. She has over 30 years of healthcare experience, 25 of those with ARUP. She's worked with just about every major health system in the United States that we know of. So without further ado, I'll turn it over to Jerri.
Thanks, Eric. Thank you for coming out. I know it's the end of the day, and this is probably a chance for you to sit down and rest your feet. So let's go ahead and get started. As Eric said, I'm Jerri Turner-Jacyno with ARUP. I spend a lot of my time in healthcare on the East Coast, working with a lot of the large academic medical centers, health centers. Some of you I know, some of you I've not met before. I think you've been at some of our presentations in the past. You look familiar. So thank you, welcome. With that, we'll go ahead and get started. So most of what we'll talk about today is not going to be earth-shattering to you as laboratory experts and the factors pressuring us in our industry. But I wanted to share with you some of the recurrent forces affecting healthcare in general, and then what the trickle-down effect is for laboratory, and then laboratories' opportunity to participate in part of the solution with healthcare. So most of what we'll talk about will not be surprising to you as experts. Healthcare has been going through evolution for the last 3 decades that I've been in healthcare. So the technology and innovation is great. We're advancing very rapidly in the United States with opportunity to improve outcomes in patient care. But they're very costly and they're very expensive, and they don't always deliver better outcomes than some of the older methods that we have, but they do cost a lot more money. So we have to find ways to be more efficient and more effective in our hospital and healthcare setting. And as such, we also are developing lots of things around pharmacogenomics and pharmacy. There's bigger and more expensive spend in pharmacy. There's an opportunity for lab to assist with that. We're doing more targeted gene therapies for very small population groups, which is great as we advance towards population health, but they're expensive and they cost health systems and payers a lot of money, and they're looking for solutions. They're looking for others in the healthcare system to step up to the plate and see how we can assist with that. Government regulation, I don't think I need to share with you that we've always had government issues related to payment structures, the DRGs in the early 80s. Those of you that have been in this space for a long time, managed care was a pressure that we dealt with, and most recently now with the ACA. In every single one of these occasions, laboratory has always risen to the occasion. We've stepped up, we've been a part of the solution, we've gone to administration and said, okay, we can be more efficient, we can automate, we can do more things to assist the healthcare system. So the payment models are changing. What we want to talk to you today about is we want to challenge you and encourage you to go back and tell your story. What laboratory does and what contribution we can have for the future. Demographics play a role, obviously, in wellness and patients' abilities to get much needed care. Social economics, we understand that, and we're working hard as health systems to address wellness and address patient care in general. This is a statistic from the Bureau of Labor and Statistics, and it just shows very quickly the amount of money and the percent of the GDP that we're spending on healthcare. In 1980, we were spending 8.9% of our GDP. In this year alone, we will be spending 18.2%. It's no surprise that healthcare is at the center of all political discussions and all healthcare discussions. We are, for the first time, in unison related to healthcare across party lines. This is a survey that was done by KFF Health, and it demonstrated that everybody recognizes that our cost has become much more expensive, our outcomes have not become any better, and that we need to make sure that we keep the pre-existing condition in the ACA model, regardless of what transpires in Washington. So it's just a nice way to demonstrate that we as a population are all in unison around what we need to do with healthcare. We're moving from a situation where we've dealt with sick care. A patient would wait and have a symptom. They would either run to the emergency care center or call and make an appointment with their physician, into a scenario where we're looking at putting the patient at the center of all that we do. And when we talk to you today, we want to talk to you from the perspective of lab's opportunity to have touch points in all these areas. If I'm a patient and I went to the emergency department, when I left the emergency department in the old model, I then would have to take the responsibility to run to all these other places. I'd have to go to my primary doctor. I might have to go to the pharmacy. I might have to then run and get imaging in 2 or 3 days. The model that we're shifting to today, we're moving towards an opportunity to make it more convenient. This is a survey done by the Kaufman Group in 2018, and it shows the areas that CEOs identified as top opportunities for health systems to become more cohesive, to make it more easily accessible to the patients they serve, and to aid with the patient experience. So the first 3 you'll see, it's a gap analysis between what they think they currently can provide and what they would need to do and expand their services. So the first 3 are around the customer experience. It's around the facility access points, creating and moving things more in the outpatient setting so it's closer to where the patients reside. And then looking at utilizing digital tools, mobile apps. Many of you may have your patient health record already on your Apple app or some of your other apps. We are a big business, and never before has it been more apparent that there's opportunity in healthcare than in the recent last few months with the new merger with Amazon and Warren Bennett, and that group in Boston, and their goals towards improving healthcare and reducing the cost, because their employers, in the plan that they have alone, they will touch over 1 million patient lives. And what we want to talk to you about related to those type of developments is, what can lab do? What role can lab have? Providing price transparency is one of the last items that they've identified. It's important, but there's a huge gap in their ability, to provide information to the patients that they serve. The slide that I don't seem to be able to get back to was just simply a survey done with consumers, patients going through health systems, and whether or not they would be willing to look at things like telehealth. Would they be willing to go to a Walgreens or a CVS to have sutures removed? Or would they be willing to go online to a kiosk for follow-up type questions with a physician? 2 years ago, the statistics were running in the low 40s across that survey in those categories. And most recently, the survey that was done in 2018 indicates that the high 50% to 60% of all consumers are willing to look at alternative care if it's less expensive and it gives them an opportunity to maintain their health. The model that we see unfolding before us today as we engage with the health systems that we work with is a focus and an emphasis on access and patient convenience. And as you'll see in this model, there's 4 key areas of delivery that they've pinpointed and identified that they need to focus on their patient care. So obviously wellness care, ambulatory care, community care first and foremost, the ambulatory care, the aged population. With the baby boomers coming in, higher need for health care, it's more expensive. Hospitals are looking at having to be more efficient in the delivery of their extended care, their ACO models, their medical home models, all of it centered around getting the patient healthy, keeping the patient healthy, and using the resources within the hospital to do so. You'll notice that we've identified laboratory as one of the key elements in a healthcare system that has the ability to influence and improve every single one of these, not just from an efficiency perspective, but from a patient satisfaction perspective, a physician satisfaction perspective, and more importantly, cost containment and outcomes. And so we want to challenge you to go back and talk to your CEOs. Use your lab data. Talk to them about the roles that you can play. How many of you are involved in healthcare systems that have some utilization management programs or are starting to do some things with your physicians in telehealth? Okay. So there's a few of you that are starting moving in that direction, and that's very encouraging. My concern is that as laboratorians, we're conservative by nature. We often don't want to go to the C-suite and talk to them because most of the time when we leave, they've asked us for a 10% reduction in our service line. And so many of us shy away from going there. What we'd like to encourage you to do is today is dig through your data, dig through your information, get some of your own success stories. Go to your C-suite and tell your story. Tell them about your ability to contribute towards utilization management, the ability to deliver towards patient outcomes. I don't know how many of you were able to attend Dr. Fletcher's talk earlier. Were any of you here? So I've had the opportunity to work with Dr. Fletcher when he was at the health system that he referred to in his presentation. And I saw firsthand a CEO who I had worked with in Florida who said, yeah, we have lab. They're a very small percent of what we do in healthcare. They're good. They take care of our patients. To a CEO that completely shifted gears and recognized the value that pathology and laboratory can play in better patient management, cost containment, and efficiencies. I saw firsthand a CEO who didn't want to have anything to do with me and talk about lab suddenly embrace Dr. Fletcher and say, wait a minute, we're not funding laboratory. We need to fund laboratory. What a huge opportunity for us. I will tell you, this is a statistic that many of you know as the experts in this space. It's a statistic widely used. Anywhere from 70 to 80% of every patient's chart has data that we've provided to them in the form of a report or a result. It's actionable data. It drives most of the therapies and the treatments and the follow-ups for patients. What we don't always do as laboratorians is talk about the relative incredible value of that deliverable. For 3 to 5% of the total healthcare spend, we influence 70 to 80% of all the actionable items with patient care. So we'd like to motivate you to have different conversations with your administrative suite. Because if we're not talking to them as laboratorians, industry is going to talk to them about the fact that we're a cost center. And I will tell you, never before have there been more industry partners, consultants, hedge funds, investment groups interested in laboratory because of what we're doing in molecular medicine, pharmacogenomics, genetics, and other general health care. And if we're not telling our story about how we sit at the center of that episode of care, others are going to be in telling a different story, and they may not be using the data that we have to demonstrate the influence we can have on those patients. These are just some areas that we're working with clients on through our consultative services group as touch point opportunities for lab to engage. So hospital information systems, we all have them. Most of us don't love them. Most of the time they do what we need them to do, but they do not play well with financial systems, billing systems, outreach systems. We're working with clients to identify other tools and mechanisms that will make that more efficient. Dr. Fletcher may have referred to some tools that we are making available to our clients for that purpose. But these are just some of the groups, hospitalist groups, pharmacy, radiology, reaching across the aisles, trying to be the leaders in bringing that cohesiveness together for patient care. Our challenge to you is that we have the opportunity to bring contribution across all of the three key areas that the CEOs and Washington have identified as areas for healthcare improvement. And that is with laboratory stewardship, laboratory efficiencies, and laboratory growth. All of these contributing to more and better efficient care, cost containment, and patient improvements for outcomes so that they in turn can take those messages to the payers and drive better payments for the health system. This is an example of statistics shared. Most doctors, when surveyed, readily agree that they will often be requested from patients. Patients are much more sophisticated. They're consumers now. They're doing a lot of their own research before they go to their physicians. 47% of the doctors say that in a week's time they will order an unnecessary test or an unnecessary procedure. 72% of the time they'll do it, even though they know they shouldn't, but because the patient's encouraging them to do so. So the statistics are staggering about the opportunity for ARUP to work more closely with our clients to tell our story and our contribution, to eliminate the waste and the redundancy in healthcare, and to leverage our expertise and get back out across the aisle. The pathologists used to be the experts in the hospital system. Physicians used to come to them to ask them for clinical decision guidance around test selection. We are the experts in our space. We want to get back out there and do it. So how do you take your lab data across the service lines and better stewardship? Dr. Fletcher talked a little bit about it. You need to provide a cohesive, easily user-friendly tool that sits at the point of patient interaction, that's non-invasive to the physician's workflow. You need to make sure that it readily has the ability to pull up previous results and can identify when a test has been ordered in duplicate scenario. And it needs to have actionable references for them to then look at going to the next step. This is just a screenshot of how ARUP is partnering with our clients to begin to address the needs in a value-based care model. As we shift towards that model, evidence tells us and dictates that insurance companies are seeing that the value-based model is having a direct contributive value to patient care and outcomes, so it's not going away anytime soon. As such, we're investing in tools and resources to make available to our clients as part of what lab brings to the table in their hospitals to better educate the doctors, to make it more user-friendly, to put it at their fingertips. Right now, we have over 3,000 to 5,000 tests and assays out there, but we expect clinicians to know what all of them are and which is the most timely, relevant test to use. And this is a way for them to quickly see the price transparency. It's a way for them to help manage the financial stability on the patient's behalf, so that we're not constantly ordering in redundant fashion tests that are either unnecessary or inappropriate. Physicians identified that oftentimes there are tests that just aren't appropriate for the patient's care. This is another snapshot. We find that lab as part of the cohesive care is just one component. It works in tandem with other diagnostics, right? So pharmacy and radiology are our partners in diagnosing, treating, and managing the patient. As such, we have the opportunity to better use our tests and our technology to help them effectively manage what they're doing. So this is an opportunity. It quickly brings up alternative opportunities for antibiotics or drugs that are less costly, maybe generic formulary drugs that have been identified by your health system. It brings up the previous lab results and the dates of when those last tests were ordered, so it can help you eliminate the redundancy. And then, of course, radiology is a big issue in hospitals. And we have the ability, I think Dr. Fletcher might have talked about it, to use the Wells score and use inexpensive laboratory testing to determine whether or not we need to even do another CT scan on a patient. As we shift from fee-for-service to bundled payment structures and reduced reimbursements, it becomes more and more important. This is just a quick snapshot. Dr. Fletcher may have shared with you. There are 2 pilot sites with our partner that they've had in place for quite some time with this tool that we're using for physician education. And in both settings, it shows you the difference between those that were users of the ribbon and those that were not using the ribbon. And you'll see in both healthcare systems there was the opportunity for a 200 plus savings per DRG per day. So that's pretty significant. We're easing into it. It's not huge, but it's actionable, and lab plays a key role in that. And so success happens when we talk to one another. Success happens when we get outside of our walls at the laboratory and we go back to doing what we used to do in healthcare. and that is be the content experts around laboratory medicine and put it to work in pharmacy, imaging, and collaborate with our partners. And so as such, we would like to challenge you to go back and ask yourself some questions. Is your lab running as efficiently as it could be? An efficient laboratory is the best way to start to drive the value of your physician group and your pathology group and your laboratory team. Errors are huge in laboratory. Outreach. Outreach, we like to refer to outreach as outpatient services. So outpatient services, outreach, as hospitals are coming more together, you're buying your physician practices. We're finding many of the large hospitals that we work with have a tremendous amount of leakage going outside their healthcare system. They're losing that testing, which means that it's not in their electronic medical record, which means that it becomes fragmented and not as easily managed towards better outpatient outcomes. And as such, we see there's a 10% opportunity to reduce a 10% cost for driving significant revenue in your laboratory. We have a tendency as laboratorians to shy away from outreach because CFOs already always ask us how much of an investment that's going to be. What I would ask you is how much of your work is leaving your lab and going to competitive laboratories, and what does that quantified value equal? This is just a quick snapshot and a testimonial from a doctor. It's an endocrinologist at Swedish Covenant, and he talks about if patients trust the lab and the turnaround time is quick and efficient, they have a more calm sense of well-being. They have confidence in the health system. They have confidence in the care delivery. And then the one to the right is the CEO of a healthcare system that says the investment in their laboratory over the last 2 years with improved automation and systems is allowing them to remain relevant and to be more efficient in their care delivery. This is another one. Mount Carmel talks about the fact that they've had an 18.5% growth in their outreach business, and their revenues have grown by almost 50%. Telehealth is right around the corner. We want to challenge you that lab has an opportunity to work with physicians and play a role in telehealth. And we can't do it alone. We can't do it in silos. And we want to encourage you to take advantage of your lab partner, your reference partner, other partners in the industry, to begin to cross those siloed service lines and collaborate with them, and more importantly, share your story, share your expertise. Thank you. Any questions? Good. Thank you. Appreciate your time.